Assalamu alaikum and welcome everybody. We welcome you to the final of Pakistan Society of Gastroenterology Super League. This is the fourth and the final session, and I believe we have full quota of our teams with us. Said bhai, is that right? Yep. Rahti. So shall we give them maybe a couple more minutes? Okay. That's fine. Challenge. Okay, then. Professor Shah Rahman, do we have your permission? Oh, Dr. Altaf, Professor Altaf Alam is here as well. So, do I have your permission to make a start? Thank you, sir. Okay, so obviously, let's make a start. Wish you all very good luck. Concentrate, and I'm sure you've done an amazing job so far. It's all kind of in the hand of sort of Saeed Saab and technology. I've got nothing. I've got no controls here. So it's all over to you. Bismillah ar-Rahman ar-Rahim. Let's make a start. Let's have a first question, please. So there's a 40-year-old female who presented with loose stools, Bristol type 6, 4-5 episodes per day, with bloating. There's no weight loss, nocturnal diarrhea, or blood and mucus in the stool. She had normal colonoscopy, endoscopy, and I think she also had some cross-section imaging, CT, celiac, and thyroid. They were all normal. So based on the osmotic gap, what do you think is going on? So we have 1, 2, 3, 4, 5 A, B, C, D, E options. They're not labeled as A, B, C, D, but I guess you can all make out A, B, C, D, E. A very key question, one question that you mustn't forget asking anybody with diarrhea history is nocturnal diarrhea. Are they actually waking up to move their bowels or not? This one question can, help you a lot in terms of differentiating between organic and non-organic diarrhea. So 10 more seconds to go, and I believe it's also to do with the fastest finger as well, isn't it? 2, 1, and time's up. Excellent. So we have lactose hydrogen test as the best answer. 6 people got it right. And let's see who got the... So Bolan is on the top. Brilliant. Excellent. Good start. Okay, so let's go to the question 2. So this is a 70-year-old with pain in the right hypochondrium, fever, vomiting, borderline tachycardia, temperature with tenderness in the right upper quadrant, full blood count and metabolic panel is normal, and amylase is 71. The ultrasound reported multiple large gallstones, pneumobilia in the gallbladder and bile. There's some distension of the duodenum and gastric bubble. And what's the most likely diagnosis? Are you guys able to see the full answers? Said Saab? I think the whole answer is missing. Can you guys see the whole answers? So cancers. Okay. So last 3 seconds. So cholecystoduodenal fistula. Okay, I guess in the interest of time, we're not discussing the options here. But I guess this was the pneumobilia and the gallbladder. I guess that was the giveaway in the last question. And I guess that was the only thing I could recall on that questions. And I haven't been through these questions before, so these are as new to me as these are to you. So we've had 2 questions. Bolan remains on the top with 161 points. And question number 3 of 12. So which of the following have the strongest clinical data supporting efficacy in reducing global symptoms of irritable bowel syndrome. Again, it's not very obvious here, but I hope you guys can see it.
So option A is 6 food elimination diet. Option B, elimination of gluten. Option C, elimination of long chain fatty acids. Yeah, it's clear now.
Lactose and elimination of high FODMAP diet. So, I mean, I guess you all know irritable bowel syndrome is essentially a diagnosis of exclusion. And there are sort of WGO guidance and guidance from other societies as well in terms of something common in terms of the dietary elimination. So hopefully this should be pretty standard and straightforward question. I think the earlier screen was better. You know, the earlier screen was better with the... Oh, good, you've got it. Perfect. So last few seconds. Time's up. So FODMAP. I hope it shouldn't have come to many as a surprise. Excellent. So Lahore Wolves taken over. Brilliant. Okay, let's move on to the question number 4. थोड़ा सा वो question दे दें, please. So 65-year-old presenting with symptomatic anemia for 2 weeks. No history of hematemesis, melena, on aspirin for ischemic heart disease, hemodynamically stable, hemoglobin around 8, and microcytic hyperchromic picture. So nothing on the digital rectal examination, normal top and tail camera examination, and they went on to do push enteroscopy. Not sure why they did it, to be honest, but I guess the purpose was to do small bowel examination, which probably would have been better to do a video capsule endoscopy if that was indicated. So you've got 5 options, A to E. I'm sorry, I might have given the answer away here if you were listening. So the final correct answer is 7. Okay, so Lahore Wolves on the top. Brilliant, excellent. So move on to the question number 5 of 12. So this is a young 25-year-old, food poisoning, managed conservatively, and 6 months later develops nausea, vomiting, early satiety. No history of fever or weight loss, normal upper GI endoscopy examination, gastric scintigraphy, 31% meal retention at 4 hours. So most appropriate recommendation to manage this patient next. So the answer is in the last line of the stem, if you read it carefully. Also important thing to bear in mind is your patient's age as well. Last 10 seconds. Time's up. Good, excellent. I can see the thumbs up. Very good. Well done, Lahore Wolves. Staying on top, Peshawar catching up. Excellent, let's move on to the next question, please. So we are almost halfway through. So a 40-year-old for radiofrequency ablation of Barrett's C4M5 with high-grade dysplasia. Follow-up endoscopy and endoscopic histological absence of Barrett's or carcinoma. So what are the follow-up recommendation? So it looks like a good job for a 4 centimeter segment of Barrett's. What should you do next? 5 options. Again, you've had some good talks. One of by Dr. Hala Fatma. I think if you were concentrating. So again, if you were paying attention to the talks, Hala had a very good talk, and I think the answer is there. Last 10 seconds. Barrett's is virtually gone following radiofrequency ablation. Oh, excellent. So you all got it right. Brilliant. See, so it's really good to know. I think organizers would be happy that audience were paying attention to the lectures. Brilliant. Okay, so Lahore remains on top. Excellent. Let's move on to the question number 7, please. So young female incidental finding of pancreatic cyst on ultrasound. CT shows cystic lesion in the body of the pancreas. EUS done, revealed pancreatic cystic neoplasm that was 2.5 centimeter and had atypical cells with solid component. Everything else looks okay. What should we be doing with this patient? Again, if you attended Professor Faisal Jaffri's lecture, I hope you should be able to answer this question easily as well. That's brilliant, because obviously you've had the talks and now you've got the question. Anybody wish to shout out the answer? She's female, pancreatic cyst. Okay, last 4 seconds. Requires resection. Very good, well done. There's possible mucinous or even adenocarcinoma, but there's a definitely malignant transformation there with the solid component. So good. So Lahore was brilliant. Keep going, everybody else. Let's move to the question number 8. So 50-year-old underwent ERCP for chronic calcific pancreatitis. Which of the following features, if present in this patient, will increase risk of post-ERCP pancreatitis? So again, we've had a brilliant talk from Professor Waqar Ahmad and obviously Professor Saad Niaz earlier. Okay, so last 15 seconds. Okay, sphincter body dysfunction. How likely it is for sphincter body to occur in this situation? Good. Okay, so Lahore was brilliant. Others, keep it up. Let's move on, please. So it's very unlikely for sphincter body to occur with chronic pancreatitis. 38-year-old man with 2 years history of burning pain in epigastric region that do not respond to PPIs, no history of chest pain, weight loss, regurgitation, hemodynamically stable with everything else, blood profile normal as well. So what are we going to do? How are we going to manage this patient? Again, we have some superb talks. including one of our mentors for this group, Professor Javed Farooqi, who I can't see here. I think this session seems easier because Kamran and obviously Sheikh Rahman had all the appropriate talks leading up to this session. So thumbs up. Okay, last 3 seconds. Very nice. So you picked up on the clues nicely. And I'm sure Professor Javed Farooqi would have been happier as well if he was here, if he's watching it online. Okay, keep going. We're nearly there. 3 to go. So 45-year-old with rheumatoid arthritis, chronic arthralgia on non-steroidals for symptomatic benefit. Which formulation is associated with highest risk of peptic ulcer disease complication? I would find this one tough one. There's also a phenomenon called convergence. So I would personally criticize whoever wrote the question, because this question can easily lead to a convergence phenomena to get the right answer. So convergence is obviously, for the question writers, is that you design a question in such a way that you actually bring all the candidates to the right answer automatically. Okay, so last few seconds. Brilliant. Very, very good. Oh, I like the divide. Okay, good. So thank you very much. Lahore, others chasing up. Let's move on, please. So second last question. 45-year-old, recently admitted for upper GI bleeding. Secondly, to giant pyloric ulcer, readmitted with abdominal discomfort, nausea, vomiting. Exam revealed distended abdomen, mild tenderness, and slouching sound. Abdominal X-ray was obtained in the emergency. Is this stem complete, or are we expecting something more? So, just based on what information you have, just utilize that information. We don't tend to do a lot of abdominal X-rays. Haji, go for it. Again, if you were listening to Dr. Saqib Ahmed's presentation yesterday, remember there's one category that he was trying to stress upon, those who are. That's all you've got. I'm really sorry. So I guess, I know in resource poor setting it may be difficult, but if anybody comes in this situation, how much information are you really going to get by abdominal X-ray? You really want a CT scan in this situation, irrespective of whatever the X-ray shows. I mean, you've got enough, alarming features on the history. Okay, last one, please. So what Dr. Saqib Ahmed was mentioning yesterday was the rebleed risk, the one who he was actually concerned about. So last one, which of the following is the most common functioning pancreatic endocrine tumor? Gastrinoma, gluconoma, and encinoma, VIPoma. Well, we always admire your knowledge, and I'm sure you're going to get this right, all of you. I guess 10 seconds were more than enough for this. To be honest, I know we've got time, but I really want to pay tribute to Waqas, Kamran Hassan, Professor Shah Rahman team, because I think they have taken the idea to a next level. This is way better than the format that we came up with originally. I think this is way, way better. So many, many congratulations to Waqas, Professor Shah Rahman, and Kamran Hassan. Because this one, it involves everybody. Two, it's entirely dependent on the time that's set by the website, so you don't actually have any control. I think if Shahzad is here in the room, he has got a case which he's going to be doing an RFA very soon. Okay. Oh, there was a bit of a divide. Okay. Fantastic. So we come to the finish line. And congratulations to Talha. I'm not too sure who he belongs to, whichever team he belongs to. So many congratulations. Is this the cumulative score or is this the score for this round? Okay. Fantastic. Okay, so I think the cumulative score will probably be announced later on, and there will be a award ceremony right at the end. So congratulations to all the teams who participated, and as I said, many congratulations to the organizers. Very good. So Professor Kamran Hassan tells me that the award ceremony will be with the annual dinner. So all the best, and I think the results. Are we going to announce cumulative results at the end? Okay, yes, fine. So I think the results will remain a little bit secret. So we want to still keep the element of surprise open for you guys. So, but well done. Congratulations.